Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today? You guys are not going to believe who I have on the show today. I gave him a nickname. I don't know if he knows it yet, but I'm about to tell him right now. I call him the Melanin Queen Maker because boy, does he make some queens. I love your Instagram feed, Dr. Ogu. Thank you so much for coming on the show, and I'm so happy to have you.
Thank you. It's my pleasure to be on here, and thanks for the nickname. I'll add that to the other ones that I got already.
What are your other nicknames you've been called?
I've been called the Waist Snatcher, Dr. Stan, obviously. That's the name that I use, and all kinds of nicknames.
All types of nicknames. Well, on the show, we talk about a lot of booties. We talk about mommy makeovers and we talk about surgery and recovery. And what my girls really love to hear is your personality and how you approach your surgeries and how you get those amazing results. So I'm going to start off with something that you filled out on your questionnaire that I loved. And the question was why you chose to be a plastic surgeon. And I'd love for you to share that with us.
Yeah, so my journey to become a plastic surgeon actually wasn't something that, I would say that I wanted to become since I was a child. I wanted to become a physician, but, here in America, you become a doctor, you have to decide the pathway that you're going to follow. And so I knew I wanted to become a surgeon, but I wasn't sure what kind of surgeon. So I approached, med school with an open mind. And as I went through the rotations and shadowed different positions, I saw that I was attracted more to specialty that had to do with working with my hands. And so I went into surgery. And I initially went into general surgery. And while I was going through my training, I got opportunity to work with a lot of different kind of surgeons, from heart surgeons to orthopedic surgeons, general surgeons, colorectal surgeons, and plastic surgeons, obviously. I found out that my personality meshed and matched the best with the plastic surgeons, and also the interest in the kind of procedures they were doing, which was mostly restoration of form and function to different parts of the body, was what really got me most interested in surgery. And so the more time I spent with them, and also the more I got my hands dirty working with them, I realized that this is really what I wanted to do. And that's pretty much how I found myself as a plastic surgeon.
I love it. Yeah, on your form, you wrote, the ability to affect positive change with immediate results is something that drives you.
Yes, absolutely. So, that's one thing that we as plastic surgeons, I would say, and a sense of support from most of the surgeons. You see the results right away. They're immediate. And not only that, the results get better with time. As long as the patients can stick to your post-operative instructions and the regimen that you set aside for them, most times, the results only get better. We know that, what we're doing, especially we, the cosmetic surgeons, it's not like, the patient is sick or these are mostly healthy patients, but many times they're looking at themselves in the mirror, they don't like what they see, or they have an area that is of concern to them, or an area that they wish looked different or better. And so we're taking these areas of concern and improving them. And once the person looks better, they feel better, they can go out there and do better, whether it's personally in relationships or business-wise, mentally, emotionally. These are some of the changes that we actually affect that we don't see in the physical, but really it's part of the effect of getting plastic surgery.
Dr. Ogu, it's my favorite part of the surgery. The transformation, I call it like it's a butterfly transformation because during the recovery, they're kind of in the cocoon. And then when they come out and they're feeling better, they're blossoming into the whole new beautiful self that they're becoming.
Yeah, absolutely. So, and it's, it's just awesome to see that change. You have a patient that walks into your office the first time you meet them. Sometimes they're not even looking up or looking you in the eyes or the face because they're just not happy with the look. They're ashamed of their appearance. And, they come in 3 months post-op, 6 months post-op. They look different, they're dressing different. It's confidence. They're walking down the hallway. They're speaking differently and confidently. So that's one thing that really excites me about what we do.
A gift. It's one of the parts of my work that really drives me, helping women through that transformation and watching them become the more confident version of themselves on the other side. It's my favorite. So something that I see on your IG feed, and I think I'm going to talk about it and I want to bring it up and just highlight how you do this. You are able to give your girls such a beautiful shape after surgery, after their makeover. And one of the things that I really loved about your feed, and I always get asked this question when patients are looking for surgeons, they're looking for more patients that look like them. And a lot of surgeons don't have melanin in their feed at all. And there's a lot of patients looking for that. So I would love for you to tell me a little bit more about your practice, a little bit more about yourself, and also if there's anything different that you do that really sets you apart.
Yeah, so it's interesting that you say that, and it's actually true. I learned most of what I know about plastic surgery and cosmetic surgery, surgeons who don't look like me. And that's not a bad thing necessarily. That's just where I train and that's how I train. But as I went through my training, I also realized that the patient population that I was seeing, they had specific aesthetics and looks that they were going for. But I knew that that was not all that was out there. So I did my own research. I did my own learning from other sources. I particularly, especially when I was in training, on social media, intentionally followed the few plastic surgeons of color that I could find who were doing certain things that I thought were different from what I was learning. And so by following them and seeing some things they were doing, I thought about ways I could do it different. I also kind of met with some of them at conferences and then talked to them about, things they were doing, what they were seeing. I didn't really know that my practice was going to be, as it is now, mostly women of color. But I knew that I wanted to do something that will really impact, women of color because I wasn't seeing a lot of that out there. So we all just kind of came to a head when I finished training and moved out. I initially joined a practice actually that was heavy on keloid surgery. And if you know anything about keloids, it's seen mostly amongst population of color. So that was what I initially was doing. But as the patients came in, they had other needs. I said, oh yeah, I think I understand what you're looking for. You want to be curving, more curving in certain areas. You want the waist to be as small as possible. And all of this kind of dovetailed into the experiences and things I learned on my own during training. So naturally, you work with some other patients, they go out, they tell their friends, the family, or they put it out on social media. And, from there, it just kind of kept going and going. And so my practice now, you're right, is mostly women of color. I think I understand what most of them want, even though what they want may be changing a little bit with, what we see out there in social media. I tell some of my patients, it's kind of like a joke I have. So I look at what Kim Kardashian and co are doing now, and then I can see what's coming down the road for my practice, because that's sort of like the patient population, what the trend is following. We used to be all big with big, and now we're coming back towards a bit more moderate. So yeah, I think you have a point. For a long time, patients of color and also physicians, plastic surgeons of color have been underrepresented in what we do. And that's rapidly changing. I'm seeing a lot more physicians of color now than ever, even 5 years ago. And, even going to a meeting and just hanging out with many physicians of color who are doing similar things to what we're doing. I think that's encouraging and I'm hoping that trend continues.
Saw a picture of you and Dr. Andre Marshall at ASAPS. Did you guys present together?
Yes, we did.
What was your presentation about? I'd love to hear.
So me and Andre, we go way back. We actually were interviewing together for a spot plastic surgery residency. Most times in the room we were maybe one or two of the only Black physicians there. So we obviously struck a friendship, and we started talking about some of the shared experiences that we had. And since then, we've had a great friendship, and we finished, and we moved over to California and Texas, and we maintained that friendship. And we kind of had similar trajectories with our career after training. I joined practice. He also joined separate practice, and then at the same time, we decided to venture into private practice, pretty much within 6 months of each other. So we've had very similar experience, and we're always comparing notes. And so, yes, we presented actually at the ASAPs. It was a forum that was put together by a lady, Amy Anderson, who helps people sign up practices and things like that. And it pretty much was talking about our experience and how we moved from an employed practice to private practice. And, we just, put our knowledge out there, try to help other folks who are trying to do the same thing, making sure that they learn from whatever mistakes we made and make sure that it's a smoother transition for them.
I love that. So you guys were talking about being in a group and then going on your own and how that experience has been. I bet that was a good talk.
Yeah, it was a great talk. It was actually very well attended. There's a lot of young and even residents who are still in training who are looking to what to do next. And I think we actually gave a lot of useful information to them.
Wonderful. So I also noticed, Dr. Ogu, that, and one of the reasons why I think you're so good is because you're a plastic and reconstructive surgeon. So I feel like you see things a little bit differently than maybe a cosmetic surgeon who did not have the same training. I talk about this on the show all the time, so please.
I think if every experience you have, every little piece of training that you acquire or accumulate will come back somewhere to help you. Like I said previously, I initially did general surgery. I was a general surgeon. I've been board certified in that, all of that. And I went back for several years to retrain to be a plastic surgeon. So, a lot of the training I got as a general surgeon did not sort of overlap with the plastic surgery training, but there's some days I find myself in OR because of the training and the confidence I've built on some of the techniques of a general surgeon. For example, if you're working, doing a tummy tuck and there's a sizable hernia, some people who don't have that training are very, like, oh, I don't want to deal with this. But for me, it's just something that I saw a lot, so I know exactly what to do. So like I said, no knowledge is really lost. No training is lost. Everything somehow comes back to help you in the training. But like you said, being a plastic and reconstructive surgeon is different from, for example, being a cosmetic surgeon or just a physician who decides to go into cosmetics or aesthetics. Because you actually went through the requisite training, the required training, the residency, fellowships, you took the board exams, you got board certified. You're required to recertify every few years to make sure that you're staying up to date and up to par with what's current for your specialty. So I think there's a huge advantage for me having all that training.
I agree with you. I think it's a really great advantage. Actually, I had a phone call today with somebody who she was looking for a plastic surgeon, and the recommendations that she received, all of those surgeons were asking her to go have her hernia repair done first and then come back and get the tummy tuck. And I was telling her, you need to find a plastic and reconstructive surgeon that has had training in general surgery so they can do it at the same time.
Yeah. I mean, the important thing is finding someone who, like you said, has a training and who can do it safely, and who knows when to say, okay, this is what you need to do first. Versus, some people, any hernia is a no-no. That's not necessarily the case for me. And there's many other cases of patients like that, for different things that, I can actually lean on some of the training that I got, both as a general surgeon and as a fully trained plastic and reconstructive surgeon.
Dr. Ogu, I have a question for you. A few questions. I have a lot of questions, but let me start with this one. So we already talked on it a little bit about keloids, and I'm sure with your patient population, it's something that you have to deal with commonly. So I like to tell my girls, there's so much information out there for you. A lot of women shy away from a tummy tuck because they have keloid scar history. Let's talk about it. I haven't had this conversation on the show, and I really want to give as much information as we can. And I know you have a lot of experience.
Absolutely. So, like I said, the first 2 years of my independently practicing career, I treated a lot of patients with keloids. Now, one thing that became clear very quickly was that a lot of patients don't exactly know what keloids are. They think any scar they have that is raised and thickened is a keloid. I know there's a big difference between, a regular scar, a hypertrophic scar, which is a scar that's a little bit thicker, but still within the bounds of the incision that you have, versus a keloid. A keloid usually does not stay within the bounds of incisions. It's very raised, can be active and itching and all kinds of symptoms, but typically there's a big difference between them. And the treatment is different for each of them. So, like I said, I treat a lot of keloid patients, and currently when I have patients who come to see me in practice and they're like, oh, doc, I have keloid skin, I want to ask them, what exactly do you mean by keloid skin? Have you had any previous incisions or something that or is it, oh, my dad or mom or sister has something similar, And sometimes I'd say many times when they actually show me what they think is a keloid, but that's not a keloid. You just have a hypertrophic scar, probably because of the nature of the injury. Sometimes from a bruise or some accident which wasn't properly taken care of, and so the scar gets thickened. So I say, well, you don't have keloid skin or keloid scars, and so we don't have to take you down the road of the protocol that would use if you did. Now, for patients who actually have keloid skin or keloid scars, yes, I have to kind of talk to them about, what the options are. And also for the fact that no matter what you do, it can only bring down the chances of recurring significantly, but it's never zero. So there's always a chance that you could still have some keloid, but generally may not be as florid or as big as the previous scar that you had or the scars that you've had before. So we have all these protocols and options for patients who have them. And it's something that I worked with for a couple of years prior to starting my own practice. And so I welcome the conversation or discussion about keloids in my practice.
My next question for you is actually something I noticed on your feed, and it's something that I talk about with my girls very often, which is when you look at other surgeons or other pages before and after on their websites or on their Instagram or even on Real Self, you'll always find somebody on there that should have had a tummy tuck, but they had liposuction only. And on your page, I don't really see that. So I want to know what kind of conversations you're having.
Right. So that's actually key. That's important. How you counsel the patient prior to is really important. Now, I won't sit here and say that every patient who I talk to will eventually go with it. Sometimes there's different reasons. I've had patients who are absolutely and vehemently opposed to having any kind of scars. Like, I totally understand I'm going to have loose skin, but I just want to, get a little smaller, fit and look better on my clothes, be a bit more confident when I dress up and go out. And, we go down that route. So, but the most important thing is that they are fully and properly counseled as to what to expect. And so they're not going to come back and say, well, what's this here? What's this loose skin? So that's the most important thing, right? Now, when it comes to patients that I post, well, there's a reason why you're not going to post those, because a lot of people see this and they don't, I've found out a lot of people don't actually read a lot of what you write. They just look at the pictures. And so you see, you can put something up and say, this patient did not want a scar, did not want to get a tummy tuck. And people will still go and write, well, what's going on with the loose skin down there? so you're not going to put those out there. But when they come in your office, you talk to them, and sometimes they say, well, can I see an example of what it would look like? But yeah, I have those. I'll show it to you. But I would say for the most part, when I properly counsel a patient and explain to them, what's at stake and why they should not be scared about having a scar, be nicely placed, well concealed, hidden areas, can be hidden by clothes and all that, I'd say 9 times out of 10, they go with my recommendation. But like I said, not everyone can be convinced to do what exactly needs to be done to get the flattest tummy. But as long as they understand the limitations of the procedure that they're requesting for, then I think it's okay to move forward with it.
You're absolutely right. And let me tell my girls, my listeners. Okay, so this question and this comes up in my inbox, in my DMs all the time. And let me tell you guys, if your surgeon is recommending for you to have a tummy tuck to get rid of the loose skin and you choose to not have the tummy tuck and now you have the loose skin, I often hear man, now I'm really unhappy with this loose skin. I still can't wear crop tops like what I wanted. I can't really show my tummy, even though I'm flatter. I sometimes you can see it through the tight dresses or like when they wear high-rise pants and you can still see the skin like above the pants where it's loose there. And what I hear after that is now I spent all my money on my first surgery and now I'm going to have to wait, or I can't afford to do it again, or whatever this case may be. And because of that, I want to talk about it with my girls so y'all can think about the possibilities of maybe not liking the results if you just do the liposuction and you have the loose skin, and really not being afraid of that tummy tuck scar. Your scars are beautiful. They're so low. I see you do a lot of extended tummy tuck scars.
Yeah.
Beautiful.
Yeah. Thanks. Yeah, absolutely. I think what you're saying is key, right? Like I said, it all boils down to the conversation that you have during the consultation or the prayer. And I spend a lot of time with my patients in consultation of prayer because I want them to understand exactly what to expect prior to, during, and after surgery. And so typically when I have someone who I'm recommending a tummy tuck with the lipo, they're like, oh, no, I just want to do lipo, or I don't want to do this. So I usually start from, instead of just saying, no, this is what you need, and if you're not going to do this, then we try to find out what your concern is, right? So tell me what's really your concern about doing a tummy tuck, because I'm telling you, you need it. This is my job, it's my profession, I'm trained for it, I recommend it to you, but if you're not willing to follow it, it means that there's some concern that you're having. So I try to find out what the concern is, and then we try to work from there. Now, if she says, well, I'm still considering having kids, well, that's great. That's good to know. Because if you get a tummy tuck and then go on to get pregnant, there's a good chance you're going to need another one. So that's usually when I tell them, well, that's a reasonable concern. If that's the case, then you're probably not ready for this now. You should go finish your family and come back and get this done. They're like, well, what if I just want to get lipo? Yes, you can get lipo, because I know that you're not doing this because you're done with your family and you're trying to get the fattest tummy possible. So in that case, for example, it's okay. Just get a procedure and get a tummy tuck. But usually, if you can find out or dig deeper and see what their concern is, many times you can walk them through it, make them understand that the concern should not be exactly what stops you from getting the procedure that's recommended for you. That's going to make you look your best. And most times they come back to very happy with the results and they're, you're right, this is what I needed. So
They love it.
So,
you brought up a really good point. Dr. Ogu, we have never talked about it on the show, and I know my girls want to know. What happens if you have a tummy tuck and then you get pregnant?
Okay, so the best way to explain that is to sort of track back and talk about what we actually do during the tummy tuck. So when we say tummy tuck, it's two words. It's everyone just understands that to mean flat tummy. But what do we actually do during the tummy tuck? So during the tummy tuck, whether you're doing it with or without liposuction, essentially what you're doing is you're getting rid of all the loose skin that you can find on the belly. And also you're going down to the muscle layer where you have that muscle separation, what we call the stasis, which typically happens with pregnancy or large babies among the pregnancies, which pretty much separates the six-pack or rectus muscle that you have. It separates that. So you're trying to bring that separation back together, which gives you a flatter tummy. Then getting rid of all the loose skin, like I said, and placing the belly button in a more aesthetic location. So that's what we do, right? Now, if you do that, and then the patient goes ahead to get pregnant after the tummy tuck, what happens as the baby grows in the uterus rises from the pelvis up into the abdomen, and as it rises, it pushes everything out of its way. That baby is going to grow. There's nothing you can do to stop it. And part of what it's pushing on is that muscle that was previously repaired. Now, the muscle can only hold up for so long. That baby is going to grow for 9 months approximately. And as it pushes it, the muscle just at some point, it just loses its ability to recoil after the baby's born. So most times, not all the time, but most times, if you get a tummy tuck that's properly done and the patient gets pregnant and carries that baby to full term, most times that muscle laxity that was repaired is going to recur. It's going to need to be repaired again. In addition to that, it also stretches out the skin. We might see the occurrence of stretch marks or skin laxity, things that again have to be addressed after the baby's born. So I typically recommend to my patients who are not confident in family or they're not sure. So the patients like, I think that might want to have another baby. I was like, we need to really make up your mind before we go through this, because if we do and we get pregnant, what's going to happen? Now, of course, I've had patients who've actually done it, they're done with their family, and then an accident happened. But guess what? They're back in the office once they're done nursing the baby, to talk about what the next step is going to be. So most times, not all the time, but most times you go through the matter if you get pregnant after, because everything that we've done just gets them down. So we have to fix it again.
Absolutely. I always tell my girls, tell your husband to please not get you pregnant. Please I know you're going to be hot, and please don't get pregnant.
I know. And, I've seen that happen before, a few times actually.
Dr. Ogu, this is a really good question for you. And I get this question asked all the time, and I'd love to hear your take on it. Why do scars get wide or zigzag?
Wide or zigzag. So those are two different things. So for widening of scars, for the most part, I would say that's probably due to tension. Like a tension could be the reason. The other reason could be, the scar had an area that wasn't healing properly. And so, the healing was a little irregular. And so you have the scar widening. The zigzag, I'm not sure. Scars do not usually just get zigzag unless they're intentionally placed that way. Now, the scars could stretch out some and take a little bit of the zigzag pattern, but that would be, again, mostly intention or, every procedure that we do, the possible risks and complications. And one of them could be the breakdown of the incision, or you have the incision doing in regular fashion and having thickened or having abnormal or unusual shape, which could be a zigzag. Probably that's what we're trying to describe. Those would be the two main reasons: either a problem with the tension that was at the location of the scar, or a problem with the scar.
This is what I think. For my girls that are like, oh my God, I want him to make me as tight as possible, like where I can't even move.
Yeah, so I would say that, at least for me, the way I do it, I call it with modest tension, right? There has to be some tension because you don't want any residual loose skin, but it has to be modest. It has to be reasonable. You can't snatch them so tight that they cannot, put their arms up to their shoulders or even, kind of walk straight. That's too much tension. Now, after surgery, most of my patients are walking a little hunched, but it's not because if they stood up straight, it's going to rip up the incision. It's just because they had a lot of surgery and they're sore, and so they're trying to protect the area they have surgery. But if you make someone so tight that they cannot stand straight, that's probably too much tightness, too much tension with the incision, and it's probably going to widen as it heals.
So this, for our girls who are listening, another thing that I hear very often is, oh, I was so tight when I first had my surgery, and then now it's loosened up. So Dr. Ogu, why don't you tell us a little bit about why that happens?
Absolutely. So that always happens, right? And that's why I talked about modest tension, because the skin, which is the largest organ that we have in the body, is also the most elastic organ that we have, right? So what happens with the skin is if you take some skin and put it in a particular, under a particular amount of pressure or tension for a good amount of time, it's going to expand. That's what's going to happen. So when you have patients who have surgery, who are, like I said, brought together with modest tension, with a bit of tension, what happens is that slowly that skin itself is going to stretch out. Now, you don't expect the incision to stretch out because that's why you put sutures to put it in place, but the skin itself is going to stretch out. So you're trying to, as you're planning for the surgery, you're trying to plan for that elasticity of the skin, and that's why you're going to see some stretching out of the skin. So if it's properly done, when that skin stretches out, it gets right to the point where you need it to be. Now, there's the minority of patients, not most of them, some of them who might have some skin issues, that the elasticity of the skin is way out of proportion to what you expect. And in such patients, you have to it's a fine balance between trying to make sure that you have adequate tightness and not leaving too much skin behind, versus getting rid of all the loose skin, accounting for the extra elasticity that the skin has. And there's some genetic diseases that might predispose to that, but that's the minority of patients. For most patients, with the right tension, it's going to stretch out a little bit and be just right.
Be just right. I love that. Okay, so Dr. Ogu, before I let you go, tell our listeners, what is your favorite procedure right now?
I will say my favorite procedure right now is probably doing a Mavi makeover. And by that, I mean, because Mavi makeover can mean different things, but for most of my patients are coming in want a Mavi makeover. It's a combination of surgeries that reverse, the effects of being a Mavi. So it could be, surgery to the breast, the belly, the butt, just those changes that happen when we get pregnant. So me, the combination of surgeries, the tummy tuck, I go 360, with a breast lift or a lift with implants, so that's probably 50% of what I do now. I'd say that's probably
I like to call that the Mavi special.
the Mavi special. Okay. All right. I hope you trademark that.
Yeah, the Mavi special.
Special, yeah. So that's probably what I'm doing the most now.
And how are you liking Aveli or
Yeah.
Aveli?
Aveli, yeah. So I was actually one of the first surgeons to adopt Aveli here in Texas, pretty much. One of the biggest users is Dr. Franco out in Austin. I actually made a trip to his office just to see how he was able to use Aveli in different ways. So because I believe that if you want to do something, there's no need to reinvent the wheel. Find someone who's done it properly, that's proof of concept, and then you can go learn from. So it's one of the folks that I want to learn from. And I found out the way that he deploys it, the way he uses it. He does a lot of patients who get fat transfer to the butt, also have cell lax, skin laxity, kind of works with everything to achieve the results at once. And I brought that and incorporated that into my practice. So I have patients who either prior to or after surgery that have concerns about the cell light that they have. And now I've started doing more and more of the even as an in-office procedure, because the most important thing is getting the patients comfortable and making sure that they're doing what you're doing. And so, that fear of having to go into the OR to do something is eliminated. And unless they're having another procedure, which requires them to go to the operating room, we can do this pretty much as an office procedure. I found it to be pretty effective in reducing and sometimes eliminating cell light. We know that 90% of women above childbearing age are going to develop cell light at some point in their lifetime. So it's a big concern, and nothing in the market has really impacted the improvement in the price of cell light as Abilene has done. So I think there's a lot of opportunity there. I definitely encourage other surgeons to take it up because the patients sometimes they just think there's nothing in the back of cell light. And they don't know that there's something new in the market now that's actually pretty effective. So I talk to all my patients in all my consultation rooms. One of the educational conflicts that we have is about Abilene. So I know it's an area that there's a dearth of education and information on. So while they're waiting for me to come in the room, they're just looking through, and sometimes after coming on, they're asking me questions about it.
That's awesome. So on a booty that has a little bit of cellulite, you can do some Aveli and release those dimples that maybe weren't so noticeable before, but now you got big old junk in the trunk and now you notice it.
Yeah. So just like when you have a breast augmentation or any kind of augmentation, or you have BBL augmented the butt, things that were little noticeable or not noticeable, they get magnified, and so what I do during consultation, I also try to point out, well, you have this, it might not be so noticeable, but when you get a bigger butt, you're going to see it's going to become more obvious. And then it starts to catch your attention and draw your attention to it. So I thought, well, we can take care of this either prior to, during, or after the procedure. You can decide how you want it to go. Or sometimes it's a budgetary thing. That's if I understand, there's some time to come up with what you need to get it done. But just so you know, it's a treatment for this, but it's not a procedure that you get. It's going to be a separate procedure that can be done in the office, minimal downtime, and you see the results right away.
Wonderful. Cellulite is probably up there next to loose skin of what the problem we're having out here.
Yeah, absolutely. It's one of the most searched things by women on Google, cellulite treatment. Because a lot of women know that, if it's loose skin, maybe I need a tummy tuck, if it's fat, I need liposuction, if my breast, but the cellulite, you're like, what do I need? I don't even know. So when you look at the Google search, the search words, cellulite and cellulite treatment is one of the top when it comes to cosmetic treatments. But at the same time, a lot of people don't know what to do about it. And we have, Aveli now in the market, which is just pretty good.
Actually, I'm so glad you talked about it. I'm so glad to hear such good feedback from it. I'm actually having Avali on October 3rd, where we are having Avali on, and we're going to talk all about it. So I'm excited to hear positive feedback from the physician doing it.
Yes. And I've spoken to all the physicians who are doing it, and they've all had good things to say. There's a bit of a learning curve, but it's not that steep to me. I did a couple and I just got the hang of it. And since then, it's just been good too.
So, Dr. Ogu, before I let you go, something else that you filled out on your questionnaire was that you just started a foundation to mentor minority youth. And I'd love for you to close us out with telling us about that.
Yeah, absolutely. So that's part of what I think should be a responsibility of any physician. And certainly for me, being a physician of color, and where I came from, I learned that when I was coming up in training, I didn't see a lot of that out there, or a lot of that out there who wanted to do what I wanted to do. But I think it's important to not just be in your own little cocoon doing your thing. You should try to put yourself out there to try to help other people who might see consider opportunities. So what the foundation does essentially is, we're interested in not just mentoring minority youth, and this is something that I was actually doing individually before I said, to do it at the foundation. Not just mentoring minority youth, also exposing them to opportunities in the medical space, and also doing some charity work as well. I was born and grew up in Nigeria, in Africa, and so we also do some charity work back there. So it's a foundation that has multiple purposes for what we do. One of them, like I said, is mentoring minority youth, and also doing some charity work to give back to the medical space in Africa.
It's amazing. I thank you for doing that, Dr. Ogu. Thank you for giving back.
Absolutely. It's a pleasure.
And lastly, before you go, for our listeners, my girls are from 20 to 60, and they're all around the world, and they're thinking about plastic surgery. They're considering maybe some sort of procedure. And I'm always trying to educate them so they can be smart consumers and not get misled into something that they might regret. So with that in mind, what's a tip that you could give our girls for them on their plastic surgery journey? Something that you would tell your mom or your sister, your best friend, a piece of advice?
Yeah. So just like you said, your listeners are all over. Also, my patients come from all over. About 30 to 35% of my patients come from outside of Texas, in Texas. Most are others, Canada, the UK, Africa, all over the world. And so I've seen, patients from all walks of life and different backgrounds, different cultures, all of that. But one thing is common to all of them is that they all want to live and feel better about their bodies. And so my advice to anyone who's trying to get on that journey is, before you even decide to, this is what I want to do, or something I want to see, you need to do your own research. Because you need to, walk into that office or into that consultation, whether it's virtually or in person, informed. Because you don't want to walk in there and the surgeon is talking to you about certain things, and you're just agreeing to everything. So yeah, that's what. But fine, the surgeon is there to help guide you in making a choice, but sometimes you need to know what your goals are. You need to be able to make that clear and obvious, and then they can help guide you towards those goals, as opposed to just walking and say, okay, well, why don't we do this head to toe? So having that information, that knowledge prior to the consultation is important. And these days you can find the knowledge wherever you look. There are reputable websites that you can go to. The American Society of Plastic Surgeons is one of them, where they actually talk in detail about each and every procedure. And we have board certified plastic surgeons listed on there that you can go actually contact the office directly to make an appointment. So I think that's the most important advice that I would give.
Beautiful. I second that. I agree. And if our girls want to come see you, where can they find you? What's your IG handle or your website? Where do you want them to go find you?
Absolutely. So the IG handle is dr.stan_plastics. You have to type out the full thing because Instagram has shut it down because some of the stuff I posted. But you have to type out the full thing to find me. The website is www.stan drstanplasticsurgery.com. You can go on there and request a free consultation. You can also find out about office, its location, see some before afters, and the range of procedures that I perform. And you can also find our office number on there that you can call directly and make an appointment. You can also make an appointment by text. So you have the Instagram handle, @dr.stan_plastics. You have the website, that you can get a consultation. You also have the phone numbers that you can text or call to make an appointment.
Wonderful. So all of that will be linked at the bottom in the description of this episode. And if you guys want to go see Dr. Ogu, go follow him on Instagram, stalk him, and I'm sure you are going to be in love. His look is definitely what a lot of my girls are looking for when they're looking for body plastic surgery. They want the works.
Thank you. Yeah, I do my best. So we're more than happy to take care of any of your girls. Just reach out to me, any questions that you have. My staff and myself will be more than happy to get you to your goal.
Wonderful. Thank you so much, Dr. Ogu, for coming on. It was such a pleasure speaking with you. You shared such great information with us. I'm sure my girls and myself were so happy to hear and to learn. And we're always just cheering on the surgeons that are doing everything right and that are really caring for their patients and going the extra mile. And for that, thank you. We appreciate you.
Thank you, Mavi, for having me on and for what you do, trying to educate the public, our patients. We as the surgeons can only do so much. We're busy in surgery in the OR. You can only post so many videos and educate people. But with a podcast like yours and with the reach and the growth that you're having, I think it's making our jobs a lot easier.
Thank you. I'm trying to educate them. So when they come in and they sit in the chair, they know what y'all are talking about. They know what they're signing and they know what they're getting into. And at the end, whole new woman.
Absolutely. Thank you very much for having me on.
Thanks, Dr. Ogu. Bye.
Bye.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you. Let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey.
And don't forget, new episodes every Monday. I'll see you then.